Welcome to Creative Caregiving and Beyond. More and more people are having to become caregivers for their elderly loved ones, and navigating this journey can be really difficult. This podcast will provide guidance and give practical tips for your family. Your host is Wendy Whiteman, elder law attorney, author, speaker, and leading insight advisor in senior protocol and senior lifestyle trends. Know that you are not alone in getting the help that you need. Let's get started. And here's Wendy.
Well, welcome to the show. Today, like many of you, I have responsibilities for caregiving for my mother. And today we have two special guests that will help us along our journey. It's some great information. We have Evan Jackson, and we have Robbie Felton with Intus Care. You guys, welcome to the show.
Thank you for having us.
Yeah, thank you so much.
Well, I'm just so excited to have you on because these are a couple of young men who are college age and have come up with a brilliant idea in technology. And let's see, Robbie, so tell us a little about Intus.
Yeah, so at Intus Care, we are, our mission is to empower long-term care providers through data to deliver more effective care to the older adults they serve. And we're primarily working with organizations working with the most high risk and vulnerable populations, serving patients in the community and facilities. And we're helping them leverage their data. And we love what we do. We're passionate about this work, passionate about the end user, the provider, and the patients that they care for.
And, for us, this is something that we're incredibly passionate about. This is something that we've been working for a long time to do. Really at the core of what we want to be able to do is to leverage that data to help these organizations provide more effective care for the older adults that they serve. At the end of the day, really trying to improve those patient-centric outcomes.
Wonderful, wonderful. Well, how did you come up with this idea? You're college students at Brown University, right? And were you just in the dorm one day and all of a sudden you think of, let's start a business? How did this come about?
I wish it was that easy. but no, it was really years and years in the making. So when I was a kid, my mother was a geriatric social worker, and she would take me with her on home visits to see her elderly and disabled patients. And that had a tremendous impact on me and my development. And I got to follow her on her journey eventually to become the executive director of a geriatric healthcare facility and a health plan, and now a national board member for a major long-term care association. And every day, seeing her provide mission-driven care and figure out resources for our elders made it something that was something I also wanted to pursue. And I spent a lot of time in different long-term care facilities with her, volunteering, just learning about the space, and realized these organizations struggle to leverage data, and they don't have the tools within their software to have the capability to leverage that data and improve their processes. So we saw major opportunity here to improve the lives of these providers, improve their workflows, make it easier for them to provide the highest quality care that they're capable of providing.
Well, that is such a comfort too, because when my mom went into skilled nursing and, the family members, you're just almost a nervous wreck because you want to know that they're getting the care they need. And so you guys come up with this new technology to help monitor that care, because, the old-fashioned way is, go look at the chart, or let me go try to look it up and see what's going on. And you're trying to keep patterns in your head for your loved one. Well, this happened one day. She didn't react well to that medicine, but they did this different. So you guys are actually tracking this information.
Yeah. So we're tracking that information, displaying it, analyzing for them, putting it into the palm of their hands. And I think that's a really interesting point you make about the care providers or the caregivers who are really used to working with those paper and pen tools.
Right.
So that's really where we're helping them. And so for us, we actually had an opportunity before we started working to build the software, before we started the actual development, to actually go and work in facility. So rather than being arrogant and thinking we could learn everything from the books, we spent 40, 50 hours a week actually working with these providers, hands on the ground, to identify, where they needed our help or where they wanted our help, and ways that we could help to improve their daily lives. And so when we built our software, we wanted to make sure that process was as simple as possible for them. So everything on our software is automatic, automatically integrated. They don't have to lift a finger to get that patient data into our software. They don't have to change any of their workflows. Everything is automatically populated through our EHR integration pipelines.
Wonderful. So as you present this to other healthcare providers in the senior sector, you've made an easy transition for them to incorporate it into their program that they have now.
Yeah. So we want to make it as seamlessly integrated into their workflow, into their process as possible. And not just the transition there, but also making it digestible for their care providers. And when we're talking care providers, we're not just talking about the physicians, we're talking about the social workers, we're talking about the nurses, the certified nursing assistants, really everyone. We want everyone to have access to data. We want them to have readily available information that's going to help them improve their daily work. So that's why we first started building this product. The first people we focus group with, people we worked with were nursing assistants. And we want to make at its core it available to them and build out from there. The nurses, the doctors, the medical directors, the physical therapists, everyone should have access to this data.
Great. Well, have you found that there's a common language from facility to facility? How do you incorporate that? But is there some type of, I know there's common medical jargon, but is there a common language and common procedures? Or do you have to adapt that when you go into a different facility?
So I would say there's definitely commonalities throughout the board, with number one commonality of the focus on providing high quality of care for the patients.
Okay.
But really, all of them are slightly different. When we say, when you've seen one elderly care organization, you've seen one elderly care organization. So really the way we think about it when we work through with all of these organizations is really co-building. Really, we try to incorporate what these organizations are doing, their own process, and customize our software to make sure that it's meeting their existing workflows and their needs.
Well, you guys have gotten some great feedback. I see you were featured in Forbes magazine as well for your startup company, and you guys have gotten a lot of good support. Your advisory board is top notch. So what's next? What's next for you guys?
Yeah, no, I appreciate that. We have gotten so much great feedback, so much love and support as we've grown and scaled this business, and as we continue to scale. I think what's next is to keep trying to innovate and improve practices throughout this space. I personally don't think it's fair that all of the technological innovation is in other sectors. Like, there shouldn't be more money being spent on innovation in social media than there is in elderly care. Like, you hear all about machine learning, AI, blockchain, all these crazy terms, technology we'll never understand.
That my generation don't know what it means half the time, but yeah, exactly, those terms.
Like, they're getting thrown around for sectors that aren't helping people. Let's bring that to the elderly care space. Let's help these providers provide the care they want to provide. Let's help these patients live longer, live happier, live healthier. And that's what our focus is. That's what's next for us. We're just going to keep thinking and strapping up our boots every day and working on this.
Well, very good, very good. I know that's encouraging to the elder care sector because, people are living longer, no doubt about it. When I first started practicing law in the elder care area, my oldest clients were in their 80s, but now they're in their hundreds. So our society is going to live longer. We've got the baby boomers, my generation going into those golden years, and we do want the best technology. So kudos to you guys for coming up with this innovative idea. This is really awesome. So I wanted to ask you as well. So your mother has kind of left a legacy to you in the elder care space. And have you got any feedback from her? What is her opinion about your new venture? I bet she's pretty excited about it.
She loves what we're doing. She was a lot of this initial brains and brain trust that I had, at least learning about it.
Yes.
But now as a customer, she's like every other customer, where we have to meet her. I'm not going to say demands, but we have to provide quality customer service. So it might be middle of the night. She's calling. Calling either
one of us.
Yeah. Like,
I'll expect, right after dinner to see the Mrs. Felton on my phone. But really what I think is pretty interesting is, she's someone who, of course, knows this space like the back of her hand, but it's also someone who's seen our entire process. When I was referring to the time we spent, the months working in the facility, we were actually living in her basement, actually working, trying to figure it out, huddled together, trying to have the blankets on in the cold winter. But really, it's kind of amazing that how that journey and relationship has progressed, and really now working hard to make sure that she has the software to do what they do best and provide high quality of care.
And it's definitely fun for her. She can just call us up and ask us to build something. We can build it for her. So it's any executive's dream, honestly. Like you can, whatever she wants, we really serve her needs as well as each of our other customers.
Very good. Well, this is truly, you guys are on the cusp of groundbreaking technology, because when you're right, because there hasn't been a lot of innovative direction towards the elder care space. And when you look at most facilities I've seen, sometimes they're understaffed. With you've got maybe two CNAs on a unit that they're trying to handle, multiple residents. And sometimes it's just impossible for the human person to monitor all the different things that are going on. But if there are tendencies there, then you're sort of forewarned, so to speak. Yeah.
Right. Yeah, for sure. And that's something we want to and look to address in the product. So how can we help these organizations from an operational standpoint optimize their staffing? Especially as organizations are small or have small teams, how can we make sure that they're utilizing their internal resources as adequately as possible to meet the demand that they have?
And one thing I'd like to add to that too is, staffing has historically been a difficult issue in this space. But one thing that we're seeing across the board is, the past year we've been hearing, okay, what are we going to do to take care of our patients? What are we going to do to take care of our patients during COVID? But now we're actually starting to see that conversation shift towards what are we going to do to take care of our providers now that they've been working, 70, 80-hour weeks, taking care of all of these participants in our facility, our patients in the facility. And so I think that's going to be a pretty interesting trend that we see, not only in staffing, but how are we managing for the caregivers who are working? How do we manage that burnout and make sure that, they stay healthy enough to continue doing their jobs?
Yeah, Evan, that's a great point, because there is a lot of burnout. There could be a lot of burnout in the elder care space and just in caregiving generally, whether you have someone in a facility or at home. It's a daunting task, and it can take its toll. So that's great that technology is there. Is this something that can also be incorporated for those who are in-home healthcare, with in-home healthcare agencies as well?
Right. Yeah, it definitely is. The way we look at the space in our platform, if the data is there, we can process it and provide you insight. So we're agnostic to what kind of organization it is.
Okay.
Very good. Need access to that data, and we'll work with you to get the modeling in a format you like, to get the pull those data elements that are really core to your operation, and we can work together to get to where we need to go.
Very good, very good. Because I know during COVID, and I guess it's a trend now to do teledoc. I know my mother had a few teledoc medical appointments, which kind of made it easier for me to get her to the doctor. But if that information is available, and then it could be more of a seamless process between her home health care provider as well as the doctor, because you've got a lot of moving parts there. You've got the therapist, and they're coming all at different times. But to keep that seamless, I mean, that's just wonderful. That's wonderful.
And to that point about the teledoc piece, imagine if that teledoc when your mother was going to her appointments, if that teledoc actually had all that data in front of them and had access to see, okay, this is where, your mother's at risk. This is where we can work to improve. These are all the interventions that we can say across the board are going to go lead to that care without even having to see your mother. And so that's really what we're working to do.
Well, that's awesome. That's awesome. So if a facility or a in-home healthcare business wanted to get your technology in place, what do they need to do? How can we contact you guys?
You can email either of us. My email is Robbie, Robbie @intus.care.
Okay.
Evan's just Evan @intus.care. You can also check out our website, intuscare.com. We also have plenty of content out there on LinkedIn, yeah, just reach out to us and we can get you set up, demo the product, work together, and co-build and continue to improve upon all the great work being done in this space.
Well, wonderful, wonderful. Well, thank you guys for being on the show. You've been great, and we'll make sure that we also post your information too at the show, at the end of the show. And so you guys in the audience, you can make sure you can get in contact with them. And I'll definitely be spreading the word to everyone about your services because it's needed. We need to make sure that we have the best of technology for our senior care space. That's for sure. So thank you so much for your time, your prayers, and your just, energetic attitude towards helping the elder care space. Thank you so much. And if you guys decide to contact Evan and Robbie at Intus Care, definitely tell them Wendy sent you, and and they'll get right on it and make sure that your company is integrated with their wonderful technology. And don't forget to like our channel and subscribe. And remember, check on a senior just to make sure they're okay, because they just might brighten your day. Thanks for having us.